Chairman Farenthold, Ranking Member Cicilline, Chairman Goodlatte, Chairman Conyers, and members of the subcommittee, thank you for allowing me to submit my testimony in support of H.R. 372, the Competitive Health Insurance Reform Act of 2017. Many of you have law degrees from very distinguished schools, none quite as distinguished as the University of Georgia, where I received my degree in risk management and insurance in the early 90s. This is when I was first licensed to sell life and health insurance during an internship in the summer of 1991. All in all, I spent approximately 20 years as an employee benefits broker, licensed in multiple states, representing approximately 40 carriers. I was designated by the American College as a chartered life underwriter, chartered financial consultant, registered health underwriter, and a registered employee benefits consultant. I might also mention that my father is a surgeon in a small town, so I've seen this situation from the rural provider side as well. I've actually read the contracts. Before I go any further, I want to be clear that I believe that there were a number of problems in the health insurance market before the Affordable Care Act passed. I think most brokers would tell you that. I also think that patients, physicians, pharmacists, people who work in the hospitals would tell you that many of the problems that existed have been made worse by the lack of competition in the health insurance industry today. If I may be so bold as to ask you a few questions. Do you think that pharmacies should be exempt from the antitrust laws of the country? Do you think that physicians should be exempt from the antitrust laws of the country? What about hospitals? Nobody in this room has or would put forward a bill that exempted any of these people who actually provide health care to patients from the antitrust laws of the country. So why do we allow the health insurance industry, who controls through their contracts who our doctor is, who our pharmacist is, which medicine we can get, and which hospital we can go to be exempt from the antitrust laws of our country? And no doubt, their lawyers will tell you that they're exempt because they're regulated by the states. Nothing in this legislation changes the fact that they're regulated by the states. The groups that I just mentioned are also regulated by the states. Physicians, pharmacists, hospitals, and insurance brokers, all licensed and regulated by the states, not the federal government. None of that changes with this legislation. All of those are subject to the antitrust laws of our country, just as they should be. The only thing that would change is that the health insurance industry would no longer be exempt. I very distinctly remember a renewal letter that a client received with a choice of sign here and accept the new pre-existing conditions clause, and your renewal will be a certain dollar amount, or don't sign and your renewal will be significantly higher. The people who argue that the health insurance industry should be exempt from the antitrust laws will also defend this pricing as just good business. This was from one of the biggest of the big carriers, and they are bigger and more controlling today than ever before. They are, in fact, the only carrier available to many of my constituents today. The dominance of the market that these large carriers have enjoyed has forced many providers to move, close, merge, or sell to larger regional hospitals. The end result of this is that in the 24 counties that I represent, patients have fewer health care providers left. How is the antitrust issue relevant here? By definition, health care and health insurance are not the same thing. But when one insurance company controls such significant portions of the cash flow of all of the providers in a region, no provider can stay in business without a contract with that carrier. Therefore, the insurance company gets to determine who is and who is not able to provide health care. Sign a contract with a competing carrier, and we'll cancel your contract. Accept the lower reimbursement, or we'll cancel your contract. It's closer to extortion than negotiation. I don't believe that all of this anti-competitive conduct is technically exempt from the antitrust laws. I have no doubt that in this room, the insurance industry would say the most reprehensible of these conducts is not. But in the courtroom down the street, they know that no provider has the resources to challenge them. The fact is, most states don't have the resources to challenge them. The insurance company will simply cancel the provider's contract, and the provider will be broke, and that's the end of the case. A few brief comments to finish. This exemption is not only damaging to the consumer when they purchase health insurance, it damages the healthcare providers and therefore further limits access to health care. I don't think this issue alone solves all of the problems in the healthcare industry, but I don't think that any of the problems in the insurance market will be solved if this exemption stays in place. Just as Mr. Conyers spoke to, I think it's noteworthy that on February 24th of 2010, the Health Insurance Industry Fair Competition Act passed the House with a vote of 406 to 19, yet it was not included in the Affordable Care Act. The sharing of historical loss data primarily benefits small carriers. I think it would be wise to consider specifically allowing historical loss data to be shared to prevent costly, unnecessary litigation. And I want to thank you for your time and the opportunity to provide testimony this morning. And with that, I yield back the 29 seconds that I don't have.